Hi, I'm Nick Vernoli, a preferred brand manager from Henry Schein Medical Marketing. And today we put together a program to teach you and give you some information about nebulizers. We sell nebulizers and often hear the word T-adapter, mouthpiece, 7 foot of tubing, and reservoir. And putting it all together is what I'm going to do for you today, so you have a good picture of what it is a physician is talking about. First thing is we have a T-adapter. When we hear nebulizer with T-adapter, this is what your T-adapter looks like. We hear mouthpiece. Here's what your mouthpiece looks like. You have a mouthpiece now with the T-adapter. They want to have a medication reservoir. There's your medication reservoir. And then you have 7 foot of tubing. How does it work? Very simple. The doctor opens up the medication reservoir, pours in the bronchodilator, pours in some saline, and he puts it back on, places it in the patient's mouth and tells him to breathe normally. He puts this end on an oxygen tank or a small nebulizer motor that hums like a fish tank motor. Just produces pulses of air, and the patient sits and breathes comfortably, bringing the medication into his lungs and dilating the bronchi in the lung. This is a reservoir. A reservoir concentrates the amount of medication the patient gets simply by the fact that when the patient breathes in, he then breathes out, blowing some of the unused medication back into the reservoir. So the next time he breathes in, he will be getting medication from both the reservoir here and the external reservoir here, concentrating the amount he gets, producing a better effect on his lungs. If you have a pediatric patient cannot breathe through his mouth so easily, so what they do is they put a medication reservoir onto a mask and place it on the patient. They do the same thing with an adult who has problems breathing through his mouth, placing the medication in the cup, closing it, putting a tubing on it, and letting the patient sit and breathe comfortably. What is the reason for nebulization? Basically, it's to clear the patient's lungs. The medication has an effect where it actually dilates the bronchi, allowing more air to come into the patient's lung. Sometimes that bronchi is filled with fluids and there's not enough space for the air to come into that bronchi. When does the doctor do it? When a patient is in distress, can't breathe, comes into the office. Doctor, I can't breathe, I'm having problems, I have asthma, I'm having a bad attack. He will put the patient on this, the patient will sit there. The other reason for it is with a spirometer. You can do a pre and post test. The patient would take the test without the nebulizer. He would blow into the spirometer. The spirometer will actually do a measurement of the amount of how many liters he's actually able to hold in his lung and breathe out. And then the doctor would put the patient on a nebulizer treatment and ask him to do it again. If there was an improvement on that, then he would know that the patient is probably obstructed in some way and the nebulizer had a positive effect. If he produces a bad pretest before the nebulizer and he takes the nebulizer and it does not clear up his lung, that's a bad sign. It means that the patient may have another reason for his blockage, which could include lung cancer. So it's a very good diagnostic tool combined with a spirometer. So if a doctor is doing a pre and post test, he could get as much as $30 more for a spirometry. So a good question to ask a doctor is, are you doing spirometry? And if he says yes, tell him, you can ask him, are you doing it with nebulization? If he says no, you can certainly be consultative and improve his patient care as well as increase his income. And thank you very much for selling Henry Schein Preferred Brands.